First, the numbers. In September 2011, the Wall Street Journal reported that occupational therapists are in high demand but short supply. The Bureau of Labor Statistics supports this, projecting a job growth of 33.5% between 2010 and 2020. The national mean salary in 2010 was over $73,000. Given the job prospects, why aren't people sprinting to study occupational therapy? One reason may be that people typically don't know what it is.
What is occupational therapy?
Occupational therapy? Well,
Occupational therapy?
It's I have no idea, actually.
There's gonna be like a montage about how people don't know what it is.
it's kind of like a psychologist.
Therapist of some kind, physical therapist, hand therapist, whatnot.
Therapy that deals with work-related injuries and issues.
Therapy that has to do with your occupation.
Yeah, I guess.
It can also include activities people might be more passionate about: painting, playing music, gardening, celebrating holidays, making mini pizzas or tamales, eating and relating, yoga, partner yoga, dancing, and swimming, perhaps with dolphins.
Occupational therapy, we work with individuals and communities to get them back to the occupations of their life. And to me that means all the things we do for fun and to take care of ourselves and to be productive.
Occupational therapy is a process to enhance the physical and mental capabilities of people who have suffered some kind of physical or mental injury.
How do you know this?
Because my wife wrote the book on physical occupational therapy disabilities.
Occupational therapists help people across the lifespan participate in the things they want and need to do through the therapeutic use of everyday activities, or occupations.
Occupational therapy was founded in 1917. It was founded by a group of individuals with very interesting backgrounds. We have 2 architects, we have 2 doctors, we have a nurse, we have a social worker, we have a teacher. And because their backgrounds were varied, they brought to occupational therapy a rich, broad perspective. And I think that's one of the reasons why we have difficulty defining our profession today. One of the areas that we were working with patients at that time was we were working with the soldiers who were returning from war. We also, because conditions were not divided as they are today, occupational therapists would work with any client who had an area where they needed to work on to recover and to become fully engaged in society again and to try to become as productive as they could. We also did help people return to work, thus the occupational therapy that some people think of us today.
Practice settings include schools, hospitals, homes, private clinics, rehabilitation centers, mental health settings, and skilled nursing facilities. The client range spans infancy to old age and individuals with mild to severe cognitive and/or physical challenges. Examples of potential clients include people with chronic pain, depression, or schizophrenia, children with autism or delays in motor skill development, infants born prematurely, veterans, and people who have experienced stroke, burns, and traumatic brain or spinal cord injury.
I was working at an extended care facility. They brought a client in who had had a really traumatic injury of a kind of a truck rolling over him. By the time he got to the place where I was working, he had been basically bedridden for many, many months and super ill and super debilitated. Really, really depressed and really non-compliant. Wouldn't work with anybody in the facility. And so what was memorable for me is that he and I established this great rapport. He had kind of a irreverent sense of humor, and I picked up on that and probably used my somewhat irreverent sense of humor with him. So that's kind of one thing that's really nice about OT is you sometimes make these really great connections and you really get to use yourself. But it was really great to see him go from being able to do nothing to being able to transfer himself out of bed to actually getting up and using his walker and eventually him going home. So that was great.
A little guy who was 3.5, almost 4 years old, had only been G-tube fed and had never eaten by mouth. And so he came to me after many failed attempts at them trying to reintroduce oral feed. And what had been really hard was that they had never had family meals together. And so we worked really hard, and he progressed to where he, first of all, was at least allowing foods in the area. Then he started to eat foods. Then he started to actually eat and swallow foods. And then it progressed to the Thanksgiving dinner. And they had a Thanksgiving dinner when he was just about turning 4, where everybody was around, and he actually ate part of the dinner with the family and could be with the family. And the next session he comes in and he announces to me, I think I can have my button out, because he had a G-tube button. He was the one who made the decision that he could handle the food.
Prerequisites may include liberal arts such as psychology and anthropology, as well as sciences including anatomy, physiology, and neuroanatomy. Once in a master's program, there may be clinics and practicums for hands-on experience, as well as in-depth looks at specific populations such as pediatrics, geriatrics, or people requiring neurorehabilitation. Programs range between 2 to 3 years of coursework and culminate with 6 months of fieldwork prior to taking an exam for national certification.
I had some bulging discs in my spine, and so I woke up one morning and basically below the knees I didn't have nerve function, which meant I didn't really have brain control over my legs below the knees. So after my spinal cord injury, went and had surgery at O'Connor and then at Valley Medical Center. Was there for 3 weeks of acute rehab with an occupational therapist. Once I transitioned to rehab, it was learning what I could do or how to adjust. How do you actually get there, and how do you get in the cart and reach things on the top shelf of a grocery store if you're shopping independently on your own and things. So helping me to think through more physically what I could do, what I needed to do, what help I would need, and just sort of have the experience of going grocery shopping and knowing that I could do it and be independent. Right after I was leaving rehab, I was getting married, so I was just trying to figure out grocery shopping and making food. So it was probably some of trying to figure out that as well as driving. So I had a lot of questions about how I would get around and what I would do with that. It feels like the things that I learned through occupational therapy and trying to figure out how to be independent, how to adjust things so that they would work for me, was helpful. How to experience the world and do the things that I want to do in normal life with the disabilities that I had that had come from my spinal cord injury, and how to interact with the world post-injury.
Okay, I used to do construction, carpentry. I started feeling weakness and numbness on the left side of my body. They found a cavernous malformation, and it was on the brainstem, specifically the pons. Before my injury, I went to the gym every single day, and I was a runner, and I surfed, and I climbed. I had options all over the place. I was rich with options, physical options. 3.5 years ago, I became poor like that. I had no options. I had a great relationship with my therapist. I went to therapy 2 or 3 times for like 1.5 years, 2 years. I found that Dan, though he was an occupational therapist, he was very intelligent, so he had really broad range of knowledge about most things. Incorporating therapy is a holistic part of my environment. Looking around, seeing what I could use, and incorporating those things that were here into therapeutic movements, more or less. And when he came over to my house, it was about finding ways that I could do therapy in my own house. It was defined to me as helping you learn how to live your life again. The quality of my life actually hasn't diminished as a result of this. I can't do the same things, but a lot of the things I do are done more with more intention, with more purpose, with more fervor even.
So my daughter has benefited greatly by the occupational therapy. The number one goal that we had when we started here was to help her with her fine motor skills, because at age 6, she still wasn't able to use a fork. Before occupational therapy, my daughter couldn't enjoy things that other children enjoy, and she couldn't participate in things that other children her age participated in. And now she's better, and it's like magic, and it's life-changing. I think it's a miracle that somebody has taken this constellation of issues and figured out that they're all one thing, that fall under one umbrella, because to me it's mind-boggling. It's a struggle that we don't have to deal with every day, and it changes her whole life. It's amazing. It's priceless.
Thank you.